Some numbers flattening as Arizona works to stop the spread of coronavirus, but we are far from being out of the woods. That's according to those who spend day in and day out on the front lines of our hospital emergency rooms. ABC 15's Cameron Polam speaking to the frontline workers, sharing their insight from inside their walls.
This is going to be a challenge that's going to be ongoing for the foreseeable future.
Despite some positive news this week, Governor Doug Ducey stressing a reality check. COVID-19 remains widespread. Its effects felt no harder than inside our hospital emergency rooms.
The thing you can't lie about, the thing you can't change is one, ICU beds. And, we are bursting at the seams with need of ICU beds.
Dr. Frank Lavecchio is an ER physician with multiple hospitals in the Valley.
This month, I do not believe I've ever walked in and seen an empty bed in the ICU that wasn't filled immediately, or somebody not waiting in the ER for a hospital bed.
He says our state might have plateaued. However, we'll only know that for sure in the next few weeks. Until then, non-COVID ER visits remain constant and space is running low.
Well, there's people in hallways. Some rooms are doubled up if they have to be. You're examining people in chairs. It's just kind of makeshift.
While state contracts have been signed to bring in additional staff, he hasn't seen that staff show up yet. Critical life-saving machines like ventilators continue to dwindle as well.
I would say for some hospitals I've worked in, there's been times where there's been under 5 ventilators.
But getting them discharged, especially from the intensive care setting, is quite difficult.
Dr. Mortaza Akhtar is on the front lines inside some of our largest hospitals. The recovery time for those hit hardest is long and tedious, tying up resources, staff, and capacity.
And on top of that, this is unfortunate, but doctors are getting sick too. We've got multiple residents who are out sick.
There's no doubt the system continues to be stretched to critical levels. Just take it from one overwhelmed doctor in Yuma who also volunteered in New York.
This reminds me of New York, early March. But at that time, we had Governor Cuomo, he shut down the state. There was an end game. Here in Arizona, there is no end game.
I'm Cameron Polam, ABC 15, Arizona.